And a virologist, James Young, actually told the Independent newspaper in the United Kingdom that the downscaling of testing laboratories in the United Kingdom is effectively leaving the United Kingdom blind to these new variants. What is the situation there? And are you expecting to see a significant increase in the number of infections?
We already have seen a very big increase. The hospital that I helped to run the diagnostic lab in currently has now 90 cases of coronavirus, and that's a tripling in a relatively short space of time. And we're just one hospital, there are hundreds. So we're certainly seeing an uptick in cases coming through. What's reassuring, though, is that the severity of illness does remain reliably and reassuringly low. So what we attribute that to is that while we are getting cases, we're not getting consequences because people have either already met the virus and have immunity via that route, or more than likely they've been vaccinated, because we have a really high vaccine uptake rate, particularly in our most vulnerable population. And although that's not preventing infection, what it is doing is giving people enough of an immune foundation that they're not becoming severely unwell, thank goodness. But on the testing front, I think it's a reasonable observation that, yes, we have significantly downscaled our rates of testing. We were doing 1 million+ tests a day. It had one of the highest testing rates in the world in the UK. Many of those facilities have now been mothballed, decommissioned, or reversed, gone back to what they were doing before. And this means that where previously, when we got a positive, we were using the sample and the extracted nucleic acid, the genetic material, and we were reading that and generating the genetic code of the virus to tell us what it was. Now we are doing much fewer testing, or much lower levels of testing, so we don't have the same resolution, the same sort of scale of radar screen that we did have and that we were feeding to the world, actually. And so there is some degree of blunting of our agility.
So, Chris, you say there is an uptick in cases, but the severity of illness is low. Would it be fair to assume then that the current crop of vaccines is doing its job, even with the variants?
Absolutely. And the vaccines that have been deployed by our Joint Committee on Vaccination and Immunisation, or JCVI, they draw up the protocol for who we're vaccinating against what and when. They are currently advising that people use either the updated RNA vaccines made by Pfizer or Moderna, which reflect some of the newer Omicron variants, or the existing original so-called wild-type strain of COVID that came out of Wuhan in 2020, because we don't have good evidence that you really get much of an advantage you go against these new variants from one of these newer vaccines. They both work very, very well against severe disease. Really, we can't fend off infection for very long with these vaccines. You get protected for a while. Most of the heavy lifting is in the form of people not becoming severely unwell and not going into hospital. Thankfully, our number of people who are on ventilators is a fraction of the number that it was compared with when we had similar numbers of cases. We've currently got, we think, about a 2% prevalence in the country. One person in every 50 walking the streets of London at the moment is a case of coronavirus. We are not seeing that translating into hospitalisation at anything like the rate we did.